And we created a program that would address the needs of the internationally educated nurses. We've included the licensing process. So sabay siyang ginagawa.
And we're back once again with another episode of Spilling the Tea with your school representative. Yes, and for today's episode, we have a school representative from Stenberg College, Miss Janica Licerio.
Yes.
Hi,
Hi, Kat. Good afternoon, and thank you for the tea.
You're welcome. Cheers.
Cheers.
Yan. So, kumusta ka naman?
Okay naman. I'm working from home. And so far, safe and healthy naman. Okay ang lahat. So, very happy.
Okay.
And you, kumusta ang bagay-bagay?
Work from home din. So, minsan, pag may mga students gusto makipag-meet face-to-face, so, yun. Tsaka lang namin sila mini-meet sa office. So, we have a YouTube channel that, and we have this episode called Spilling the Tea. So, isa ka sa mga school representatives na in-invite namin, and thank you for accepting our invitation. And this is where you can spill all the tea about school, lahat ng ino-offer ng school, and lahat ng assistance, so that we can encourage our prospective students to join and enroll at Stenberg College.
Okay.
Ms. Janica, can you tell us more about Stenberg College?
Okay. So, all right. So, si Stenberg College, this is a post-secondary college located in Surrey, British Columbia, in Canada. The school started and was actually founded by Mary Jane Stenberg about 30 years ago. So, we have been in the education industry for a while now. And then in 2003, it was acquired by the Education Group. Nagmamanage talaga sila ng school. So we have a sister school also called Center for Arts and Technology. Stenberg College, we started and have always been known as a medical college in Surrey. Our flagship programs really are medical programs. So our other programs naman na in-offer namin, it's not just medical programs. We have human services, we have business and education as well. We are at a 90% local students and 10% international students. We're at the city center of Surrey, so it's a very accessible location for our students.
So, yung Surrey, malapit siya sa Vancouver, no?
Yes, so pinakakilala ng mga Pinoy talaga is Vancouver. But what they don't know is that there are surrounding cities. Actually, Surrey is the second largest city following Vancouver. And napaka-diverse ng community in Surrey. In fact, Filipinos ang third. So parang nauna yung mga Indians, China, and then Philippines. So, nasa city center siya, tapat siya ng SkyTrain station. So, kung pupunta sila ng Vancouver, that's just 40 minutes SkyTrain ride to Vancouver.
So malapit lang din talaga.
Malapit lang, yes. And it's a perfect place for the international students because the living cost there compared to Vancouver is about 21% lower. So maganda siyang starting point for international students.
Yes. And yung talagang mga students who are looking for British Columbia as their province to settle or to study. So magandang opportunity or isang option talaga is yung sa Stenberg, which is located in a much lower living cost in British Columbia.
Yes.
Malapit pa siya sa Vancouver.
Yes, that's right.
Okay, so you mentioned earlier that healthcare is one of your top programs in Stenberg. Can you tell us about this program you are offering, which is the Canadian nursing? Can you tell us more about it?
Okay, so when Stenberg started, we really focused on the medical programs such as nursing. So onshore, we have psychiatric nursing, we have practical nursing, but then we saw that there was a real need for, internationally educated nurses to have access to the licensure. Kasi we cannot deny, it's quite complicated to be a licensed registered nurse or a licensed practical nurse in Canada. Kung gagawin siya mag-isa ng estudyante, it's quite daunting. It's such a complicated process. We developed a program, partnership also with TRU, with Thompson Rivers University. We partnered with them and we created a program that would address the needs of the internationally educated nurses. So apart from studying nursing in Canada, in a Canadian context, we've included the licensing process. So sabay siyang ginagawa. So while they're studying, they're going to process the licensing, and this will have a direct access to registered nurse. Na nagiging challenge for nurses is, in the past, nagiging licensed practical nurse muna sila, and then after nila maging LPN, nagtatrabaho muna, and then they become PR, and then mag-aaral ulit sila para lang ma-access nila yung RN. May mga requirements before you can access talaga yung RN pathway. And so, tinanggal namin lahat ng mga challenges na yon. So with this program, as long as you're an internationally educated nurse, you're a registered nurse in maybe in UAE or here in the Philippines, you have a choice. Hindi lang LPN, hindi lang siya yung choice. So may choice ka to become a licensed practical nurse and a registered nurse at a shorter duration, which should save you time and money. So yun talaga yung ina-address ng program.
Okay, so basically, pinadali nyo yung process, how to become a nurse for internationally educated nurses. So instead na dumaan pa sila dun sa mga sinabi mong steps, diretso na pinag-aaralan na nila yan. Para maging registered nurse sila in Canada. So, do you offer or is it part of the program yung pagre-review for the exam?
That's a good question. So, by the way, it's called Postgraduate Diploma in Canadian Nursing. So, it's a dual qualification. The first part of the program, the student will learn how to become a registered healthcare aide. And the reason that we embedded a healthcare aide program into the core program is it's a backup plan kasi. So, yan talaga yung first stage. So, magiging registered healthcare aid sila. While they're studying, pag student visa ka, di ba, you can work. You can already be working as a registered healthcare aid. So, instead of earning your minimum $14 per hour, you can earn around $23 per hour na agad. Kasi registered healthcare aid ka na. So, malaki yung jump niya when it comes to the salary. Plus, na-i-involve ka na into the medical industry, mas exposed ka na, di ba? Yun naman ang importante, kailangan ma-expose ka na, makabuild ka ng network mo, di ba? So, that's the first part of the program. You can earn the registered healthcare aid designation just after completing 5 months of the program. And then, you will have your cooperative work experience, and then eventually, you will complete the program by studying the Canadian healthcare context. While all of that's happening, kasama sa program ang review and preparation for the IELTS and CELBAN. So I say IELTS and CELBAN because those two are the English proficiency accepted by the National Nursing Assessment Service. Included din ang review and preparation for the NCAS competence assessment. Wala silang kawala dito eh. Kailangan nilang pagdaanan to, part talaga ng license siya. So it's a 3-part exam, and it's really a make or break for the nurses because this is a very important test. Itong test na to, siya ang mag-identify ng mga gaps nila. And the thing with this test is once lang nila ito pwedeng gawin. Isang beses lang. No repeats. No, wala nang, yun lang talaga. So, one chance to prove that they are competent. And so, what we do, part of the program, is we review and prepare them. May mga simulation kami. So, yung ine-expect nila na test na pagdadaanan nila, they've done it sa school at sa labs namin. And lastly, kasama rin ang review and preparation for the licensure exam. So again, may option si student, gusto niyang maging licensed practical nurse or gusto niyang maging RN. Whichever is the pathway that they choose, we provide the licensure review and preparation for that.
Okay. So basically, in this program, parang you're hitting two birds with one stone. Kasi parang yung isa, pwede ka nang maging certified healthcare assistant. So,
Yes.
kung if ever, hindi man sila nakapasa doon sa exam, if ever lang naman ha, pwede,
Worst case scenario na yun eh. Worst case scenario, yes.
pero pwede pa rin silang maging healthcare assistant.
That's right. And in British Columbia, magkaiba pa yung healthcare assistant sa registered healthcare assistant. Most of the employers would be looking for the registered one kasi may registration number yan. Most of them would be looking for the registered one at saka mas mataas talaga yung salary rate ng registered. So yes, they're hitting two birds with one stone. All back career siya. That alone has an immigration pathway. Mas mataas na yung earning capabilities nila even while they're studying because they're already registered healthcare aides.
Okay. So, Ms. Janica, how long is this program? And you mentioned earlier that there is a co-op part that is part of this program. So, gaano katagal yung entire program from the beginning until the very end ng dun sa preparation or dun sa review for NCLEX, so sa licensure, and at the same time yung co-op na dapat nilang gawin?
So the duration of the program, if you started face-to-face, that's actually 90 weeks. So mga 1 year and 10 months, ganyan. It has a 30 weeks paid co-op. So 30 weeks would be around 6.5 months, mga ganyan. If you start the program online, there is an extended co-op of 5 weeks. So instead na 30 weeks lang yung co-op mo, magiging 35 weeks siya. Basically, itong program na to can run from 90 to 95 weeks in total. So depende sa delivery na tinake mo. Now, yung licensing process, dahil kasabay siya nangyayari, actually first week pa lang, papastart na talaga yung step 1 ng licensing sa'yo. So kasabay siya. Kumbaga na nangyayari. And we expect if you just follow the instructions, if the student just do not have any delays, if it's in the ideal world, kumbaga, by the end of your program, you should be receiving your approval for the license also. If at any case that it gets extended, let's just say, kasi third party yan, regulatory body yan ng nurses. So we do not have full control of their timelines. Just in case that happens, siguro maghintay ka additional 3 months to, I think long na yung maghintay ka pa ng additional 6 months. Pero during that time, you should be able to still stay because registered healthcare aid ka eh. Mm-hmm. Diba? So hindi ka completely walang designation while you're waiting.
Right. Okay. So, 2 types of delivery. One could be a face-to-face and another one is online. So, kung online delivery, pwede nilang piliin ano yung dapat nilang i-take and for face-to-face, kailan lang siya available and at the same time yung sa online, is it every month or meron lang talagang specific intake kung kailan siya pwedeng i-start?
Okay. So, with the intakes, normally we have 4 intakes per year for a face-to-face. That's January, March, June, and September. But because of the pandemic, we had to, make some adjustments. And that is why we started to offer an online delivery of the program. So with the online, first 6 months of the program would be taken online in your home country. So kung ako, nandito ako sa Pilipinas, mag-online ako. That's Tuesday to Saturday. 8 a.m. to 11 a.m. So 3 hours lang talaga yung live session nila per day. Okay lang na mag-start sila online without a student visa. So, while they're studying online, pwedeng dun pa lang nila inaasikaso yung student visa nila. We started an online intake in January. So may mga nag-start na kami January. And then we're running another online start on March 30. Mm-hmm. So pwede silang humabol for the online sa March 30 and still ang magiging face-to-face nila na schedule would be sa October 2021. For the face-to-face naman, kung hindi mo talaga gusto or hindi pasok sa schedule mo, yung may online ka or maybe you lack the resources for the online study, pwede naman sila na mag-face-to-face and that should be in September. So, yun na yung ina-accept namin, September 2021.
Kapag online delivery, you have 2 intakes, which one is last January, And then, meron pa tayong upcoming on March,
Yes.
is next month. And then, yung mga nag-online delivery, ang face-to-face nila will be on October. Pero kung mag-face-to-face sila, hindi sila mag-online, it will be for September.
Yes.
Okay. So, what about Miss Jenica, yung requirements na to apply for the Canadian nursing?
Okay. So it's actually very basic yung requirements namin. With this program, because we are targeting internationally educated nurses, that means they have to be registered nurses, di ba? So number one, sa academic requirements nila, of course, if they've completed bachelor degree in nursing, kailangan yan. I've encountered some people who completed diploma in nursing, which is fine as well. It's your academic requirements, so the transcript of records, your diploma, so you have to have completed a diploma in nursing or bachelor, and then you have to be an active registered nurse, of course. So you have to show your proof of registration, like yung sa PRC ID. Next is, I think ang pinaka-importante talaga dito is the work experience. Ang nire-require talaga namin in the past 10 years. 2 years full-time, paid work. It has something to do dapat with, you being a registered nurse. It's not limited to hospital work. Pwedeng personal nurse ka, pwede kang clinical instructor o kaya naman company nurse, ganyan. As long as your work requires you to be a registered nurse, that will be accepted. Hindi pwede yung volunteer work. Pero dapat meron ka ring about maybe 5 to 6 months or 900 hours of work experience as a registered nurse in the past 5 years. The reason that we're looking for work experience as a registered nurse in the past 5 years is because in your licensing with the National Nursing Assessment Service, they will only look at the past 5 years. So kahit ang tagal mo nang nagtrabaho, hindi yan makikita. Ang titignan lang nila is the past 5 years. So it's important that you have at least 900 hours because that's their minimum na nire-require ng NNAS. Now, you might ask, bakit mo hinahanapan ng full 2 years, di ba? It has something to do with their PR eligibility in the future. Kasi this program, PR ready ka na after you accept a work offer. Once you complete the program, you accept a work offer, you're PR ready. Mm-hmm. So, dun naman check na yon. That's right.
So, kaya yun lang. So, madali lang naman yung requirements kasi if you're actually a registered nurse and talagang profession mo is a nurse talaga, so it won't be a problem for you kung talagang gusto mo talagang maging nurse in Canada.
Last na lang is the English requirement. Uh-huh. Okay, so with the English requirement, normally, tinatanggap namin ang IELTS general or academic, pareho, pati general tinatanggap namin yan, overall score of 6.0. We can even look at, if you have it, TOEFL IBT, Pearson's, CELBAN. But for Filipino citizens only, we can waive the IELTS. You just submit a medium of instruction in English from your last school attended, and that should suffice. And the reason for that is, part na ng program kasi ang review and preparation for the English. Right? So, hindi namin kailangan na umulit pa sila ng IELTS because they need to prepare for a higher IELTS score or CELBAN score for the licensure. So, we can waive the IELTS to enter the program.
Maganda yan kasi dito kasi parang nai-intimidate na sila na ng IELTS para lang makapasok sa program. So, at least it's a good for our Filipino students na gustong mag-aral, na waive na yung IELTS and then meron pa sila dyang review or preparation for IELTS requirement para pag mag-aano na sila sa license. Tama?
That's right. Yes. Kapag nagpa-waive ng IELTS kasi ang estudyante, when they arrive on campus, we still have to get them to take an English test. And the reason for that is yung registration nila as a healthcare aide requires an English testing. So, pagdating na nila sa Canada, so it's no pressure to enter the program without, IELTS, or yung iba nagre-review pa. Magre-review pa yan, magbabayad pa sila ng review, tapos magte-test, tapos uulit na naman sila pagdating doon. So we want to eliminate that challenge so we can waive it, and then we'll just take the test when they arrive on campus, and then we'll provide a review and preparation also for the licensure.
Ms. Janica, you mentioned earlier that the program is 90 weeks. And I believe since Stenberg College cannot offer PGWP, so what are other ways for our student to get a work visa or work permit after they finish the program?
Yes, maganda yung tanong mo yan, Kat. And I like addressing this.